So Liz, good morning. You worked in palliative care unit, you told me, and could you explain what is palliative care?
Yes, certainly. I need to explain to you that after a long career in various aspects of nursing, I worked in palliative care as a volunteer. So I wasn't directly involved with the nursing care, but the volunteers play a very strong role in palliative care because there are lots and lots of small things that need to be done, and also time needs to be spent with people, which the nurses always don't have time to give. But palliative care is caring for people who have a limited life, who know through their doctors that their lifespan is limited, and the care surrounds their symptoms and their well-being, their general well-being, so that they can be as comfortable as possible in the last days of this limited life. Sometimes people come into palliative care and go home again after medications are adjusted or some part of their symptoms are alleviated so that they can still spend some time at home. But in general, people come into palliative care because their life is very limited.
And what's the reality in a hospital of palliative care? Because when you listen to officials, it seems that it's easy to get, everybody has access to palliative care, there is enough staff in hospital around people who are going to die. And we already had a little chat last time about it, and you told me that the reality of what's going on in a hospital is not as glossy and beautiful as what's happening. So could you tell me a little bit about the difficulty you have seen and witnessed in hospitals?
Well, it's true that the picture that's painted of palliative care rather glosses over the reality. Everybody would like it to be perfect, and of course that requires more funds to be directed towards it. Now, I understand that in recent days, especially in regional areas of Australia, money has been provided for more palliative care, and in general I think most patients who need it are able to come into hospital and have palliative care, or alternatively have palliative care in the community. But there is no doubt that there are some patients whose illness doesn't allow them to be pain-free, doesn't allow them to be comfortable, doesn't allow them the dignity that you would like them to have. And of course there's never enough staff, because it's the kind of care that requires calm, gentle, unhurried actions, and especially in a hospital it's difficult to attain that. So I've seen many patients whose deaths have not been optimal, either whose symptoms are unbearable or who are so anguished that they themselves are uncomfortable, and it hasn't been possible to quell that. For a lot of patients, it has meant that they're comforted and they die comfortably. There's no denying that. But for a minority, there's certainly a room for an alternative way for them to choose how they want to die, in my opinion.
Last time you also told me something quite interesting about the families, and you were talking about the room, the room where you usually gather, and a lot of people around the family. So in a way, palliative care is not only about the person dying, it's also about comforting the people, the family people. And could you tell me about that experience you had when the family were sort of drawn to the warmth and having a little bit of warmth from your people?
Yes, certainly. In the particular setup where I was working, the volunteers had their own kitchen, and we used to bake fresh cakes and biscuits and things for morning tea. So there was always the wonderful smell of freshly baked produce wafting through the ward. And we had a big table in the centre of the kitchen, and frequently patients, but also very often the family, who might have been at the bedside for many hours, would find a huge amount of relief to come into the kitchen, into that warm, caring atmosphere, and want to sit down and talk and offload some of the anxieties that they had, or just to be able to chat in a normal kind of way after sitting at a bedside for hours and hours. So it's quite hard to quantify the effect that has on people as a whole, but being family of a patient whose palliative care is very demanding. And so we felt that we did fill a role there to help those people at that time.
A lot of people these days die in hospital. I've seen my people in my family dying at home, and for me, my generation, people in the best we could was to provide them a death at home in their bed. And today, unfortunately, people die in the hospital. And now I was just wondering if you've seen mobile team who were able to go to people's house to help them dying in their environment, in their bed, comfortable with the people they love around them.
That does exist, and when people are quite close to the end of their lives, usually just in the last week, they can access a team. They can have already accessed a hospital-style bed to make looking after them easier, and have community nurses come in for pain relief and so on. It presents some difficulties because clearly pain relief is something you need now and not when a community nurse can come. So if it's pain relief that's paramount, then people are quite often better off in hospital. But many people want to die at home. There are lots of things to consider about that, not just the palliative care team coming in, but it requires a huge amount of work from the family as well, because of course there's all the question of linen, there's the question of hygiene, there's the question of feeding and all of those things which normally are taken care of in the hospital. In some ways people are more comfortable in a hospital where all of those things are catered for, and the loved ones can spend quality time with the patient instead of washing, ironing, cooking and all that sort of stuff. But there are some patients who die more comfortably at home, and certainly that is achieved quite often.
And let's talk a little bit about the spiritual or religious side of death. In a lot of religion, death is an important time of life. It's not just the end of the life, and people who believe think it's a beginning of something else. And in Judaism, Buddhism, Christian and Muslim, death is extremely important. And in our society, things have changed a lot. In the last 50 years, the religion is not so trendy that it used to be a few years ago. And I would like to know if the hospital staff respect the religious side, and if people ask for a priest or for prayers, and
in my experience, that is fully encompassed. Every religion is respected. People are treated totally equally, regardless of their religion, and there's absolutely open entree to priests or rabbis or whoever would be the person to give comfort to the patient, and they can come at any time of the day or night. So I've never seen that as any kind of restriction to what people want. There are people who put signs on their doors to say they don't want any of that, and that's their right as well, of course. But a lot of people do find comfort in their religion towards the end of their lives. A lot of people want to have a period where they can confess, if that's part of their religion. But it's not in any way restricted, and it's certainly respected, and also the kind of routines that are required for certain religions after death is fully respected as well. No, I think that's done rather well.
Yes, it's fantastic to hear that. And we also talked about voluntary euthanasia last time, because I'm working on that project on voluntary euthanasia. So, it's a big debate, and you gave me an article, very interesting article to read about it, and a lot of people these days have to go to Switzerland or Belgium to end their life by way of voluntary euthanasia, if they have the means, the financial means, because that's not easy. And a lot of question comes up, of course, and can we choose our death, in all lucidity? And what is your position, Liz, on voluntary euthanasia? What do you think of it?
My personal position is that I have fought quite strongly for that to become legal in New South Wales with many, many other people. I think that for some people whose lives become unbearable, either because of the lack of dignity that their symptoms have caused them to have, or because of the existential pain and agony of knowing what their death will be, especially in neurological disorders. I think it's essential that people feel that they have that choice. That's now becoming law in New South Wales, and I think it will be very interesting to see how many people take it up, because according to what I read, it's something that people want to have available, but they don't always take advantage of it. The comfort that's provided by knowing that they could make that choice if things were really unbearable for them is huge. They're really comforted by that. And for people who do choose to end their lives at a time of their choice and in the way they want to go and surrounded by the people they want to be there, I think is a total right for them to be able to do that. No one's going to make it compulsory. No one's going to have to do it if they don't want to do it, and the safeguards in the law are such that it will be very carefully monitored. But I think that it is an essential choice that people might want to have. And it's a very gentle death, and from as I understand it, the families are comforted to know that the patient is not suffering anymore, and that that's the choice that they made themselves. Now, you ask in all lucidity whether people can make that choice, but they can only make it if they are seen to be totally lucid, and it's not made from one day to the next by any means. So the safeguards are there to make sure that people are making a choice. with a clear mind. And I think they're very comforted by that.
Now I've got something as you talk, something comes up to my mind. If any form of cancer or anyone could access the dying with dignity, anyone can access the voluntary euthanasia. If tomorrow I was diagnosed with a cancer, could I have access to the voluntary euthanasia?
No, you have to be in the opinion of the medical experts that you have to interview. You have only to have less than 6 months to live, or 12 months in the case of a neurological disease like motor neurone disease. So you have to have been diagnosed with a very limited rest of your life. But everybody who has a diagnosis of cancer, of course, doesn't seek and doesn't have the right to seek an assisted death, only at the very end of their life.
Yes, it's a bit of a grey area there, isn't it? A bit of a... because there is on one side someone committing suicide and on the other side seeking voluntary euthanasia. So there is some sort of grey area that am I considered as someone who is committing suicide, or am I considered as someone who wants to? And another thing is 6 months. How do you know if the person has got it? There is a bit of a...
Well, the medical experts have a pretty good idea of how long a person's life might be. And the person who is approved to have an assisted death doesn't then have to have it immediately. They can choose when that should take place. A suicide is very different in that you don't do that surrounded by your loved ones with maybe the music that you want to be played out of life listening to, or your pets with you. It's a totally different scenario. Suicide is a very lonely and brutal response, and sadly that's what happens when there isn't that kind of choice. So happily there is now that choice for most Australians, but it doesn't happen from one day to the next by any means. Suicide tends to be a moment of madness, really, for most people, just a moment of desperation, whereas this is planned and you're surrounded with love. It's a very different thing.
Yes. And you're part of an organization. It's called Dying with Dignity. And could you tell me what your role is and what you do?
Well, my role is absolutely peripheral. I just am a supporter of this idea with many, many thousands, something like 75% of the Australian community. And so my role in the past has been to support in demonstrations and so on, but mostly to put a case before the politicians who will be making those decisions, so letter writing, petition signing and so on. But my role's very, very minimal. I'm just one of a mass of people who are very for this idea. And now I think the Parliament has listened, and while there are many people who don't agree with it, no one's forcing them to agree with it. We only asked that they would have compassion for the people who did want to have that choice.
And I think I've got a very last question. Actually, what is dying with dignity? How you would define dying with dignity, what it is? How can we die with dignity?
Well, dying in a manner that you choose has its own dignity. Dying surrounded by the people who love you and who are all in agreement with your choice and in a comfortable state with regard to your physical symptoms, and perhaps your pet dog on the bed with you, I think that's dying with dignity. I think that being drugged to the eyeballs with tranquilizers that may quell your pain in increasing doses is not very dignified, and you can't communicate with your loved ones. Having the choice of choosing the time and the medication and the way you will go is much more dignified.
Well, thank you so much, Liz. That's very inspiring. Thank you.